So welcome back to this channel, ladies and gentlemen. So today we are going to discuss what you should expect whenever you come to visit a doctor or a clinical officer. In each and every time you come to hospital, there are things that may be overlooked, but they are very, very important, and you should be able to know them so that each and every time you get to be treated, you know that you've received services that are up to the right standard and are by the book as per the training. So every time you walk in, the first things first that we normally look for are the vital signs, or rather what we call triage. So the triage is a section where mostly you'll find the nursing team, and they're the ones who are going to carry out this one, and they will take your vital signs. These vital signs, I have talked about them in previous videos, which you'll find the link attached to this particular video down in the description box. And some of these vital signs include blood pressure, temperature, pulse rate, respiratory rate, SpO2, or rather the oxygen concentration levels within the body or the blood. We'll also be able to check your weight and the height, and these two are very, very important so that we'll be able to check your BMI to know whether you are obese or you are of the right weight with regard to your height. So they will take all of these and they will be recorded, and these ones are going to essentially tell us whether how your body is doing at this particular moment with regard to your health. So they communicate a lot about you. So that point is called triage. So each and every moment you visit a hospital and that is not done, you are just ushered into the doctor's room, you know that there's a process that has been missed there, and it is very, very important for this case. Some have also included random blood sugar or other blood sugar levels to that particular list of vital signs. Now, once you walk into the consultation room, it is important that the practitioner welcomes you and gives you a welcoming statement, but it is unfortunate that most of our public or government institutions, nobody even cares to say hi to you. You just walk in and it's like you've been in a battle with the practitioner, but that is not how it is supposed to be. By the book, it is supposed to be that you are welcomed in, you are greeted, and even a smile does not hurt from the practitioner. So after that, you will be given an open-ended question so that you'll be able to explain whatever it is that brought you to the hospital. So for my personal practice, I normally ask a question like, why have you visited us today, or why have you visited me today? Ni kwa nini umenitembelea leo, ama ni kwa nini umetutembelea leo? So through that, you will be able to air out the complaints that you may have that have brought you to the hospital. So after that, the main thing that brings people to the hospital ni pain ama maumivu. Pain. So whichever pain you'll tell the doctor or the clinical officer that brought you to the hospital now will prompt the next line of questions, which we normally use to expound on pain in most cases. So there's a technique that is called Socrates that we normally use to expound on pain so that we be able to know and gauge exactly how this pain is, and that technique is called Socrates. So Socrates is an abbreviation where S stands for site, where the pain is, O stands for onset, when did the pain begin or the symptom that is ailing you begin. C is for character, how is it, because pain can either be dull, it can be pricking, it can be burning, it can also be knocking. It varies from person to person, and given ailments have specific symptom of pain. The character of the pain is very, very important. R is radiation, whether the pain is radiating to any other part of the body or it is confined to one particular part of the body, because you may be having lower back pain that is radiating to the upper back, or lower abdominal pain radiating to the back. So all these ones are very, very important that we expound. So aggravation, or the aggravating factor, that is the A, stands for what is it that when happens worsens the pain, and it is also important that we also talk about what it is that happens then the pain gets to subside. Ni nini kifanyika uchungu inaongezeka, ama nini kifanyika maumivu inadidimia. So that is the aggravating factor, so or aggravation. So it is important that you get to know that. And timing, T. So it is important to know that which time of the day we eat, at night or day, noon, whichever time of the day that the pain gets worse. E stands for exacerbation or exacerbation or exacerbation. It depends on your pronunciation, but I'll put the word for you here. So this one, it is important that we explain how the pain began. Was it gradual in onset? It started slowly. It was just poof from nowhere and then there was pain. And if it was gradual, how did it start and how did it build up until now, the point when now you are coming to the hospital. And the last S is normally severity. How severe is the pain? And we can be able to gauge severity based on whether you are able to go on or carry out your day-to-day activities or your chores, or the pain has rendered you unable to actually perform your chores or your day-to-day activities. So that is how we'll be able to expound pain, and through that, or to expound pain or any other symptom that brought you to the hospital, and through that we'll be able to really know how severe or how worse your symptom is. So after all this, the next important phase is examination. You must be examined whenever you go to a hospital. The doctor must actually touch you. First of all, they will look, that is visual examination, okay? Then they will have to touch you, okay? Not touch you inappropriately, but professionally. There is what we call palpation, okay? And through that, we will be able to examine. We examine by seeing and even touching or feeling by hands, okay? So when we begin to examine you, first of all, we look at generally what we call cardinal signs. So these cardinal signs are actually pointers that some of them could represent given diseases in the body, or how your body is actually doing at that particular moment in relation to the symptoms that you have explained. And some of these cardinal signs are pallor. Pallor stands for paleness. The normal human being should not be pale, they should be pink. So pallor, when someone is pale, we normally huwa tunashuku sana anemia. And pallor, how a doctor will look for pallor, first of all, they will lower your eyelids like this and will tell you to look up and through down here. In simple terms, it is not supposed to be white. When it is extremely white, then we'll say that you are pale. And also, the normal color is normally pink, not red. We can also look for pallor. The doctor will also tell you to extend your hands and they will look at your palms, and through that they will be able to see whether you are pale or you are white or not. So through that you'll be able to see that. Now the next one is called oral thrush or oral candidiasis. You'll be told to remove your tongue outside. We'll be able to see. So oral thrush, just fungal infections within the or other lesions that may occur from the tongue or in the mouth, okay? So those one are normally pointers towards given conditions, mostly fungal infections. The next ones are normally lymph nodes. So lymph node, the doctor will actually have to touch you at given points of the body, beginning from the chin, front, back, and everywhere, so that we see whether you have swollen lymph nodes. Then we'll look at cyanosis. Cyanosis is what we call the bluish discoloration of the mucous membrane. Most likely in the mouth, the normal color that is supposed to be there is normally pink. So in some people, especially children or neonates, the color may be blue. In some cases, if someone has ever told you that they gave birth and the baby was turning blue, that is what we call cyanosis. That is something else that we normally examine for. We also look for the features of dehydration, and this one we just gauge by looking at whether you have dry mouth, whether if it is a baby, whether the eyes are sunken and every other thing, whether the skin is dry. So we'll be able to look at that. So we have talked about that one also. The next one that we normally look for in those cardinal signs is what we call jaundice. So jaundice is the yellowish discoloration also of the mucous membrane. We normally look for it at the sclera. The sclera is the upper part of the inside of the eye. So we raise your upper eyelid and tell you to look down. So this upper part, when it is normally yellowish, that is what we call jaundice. So jaundice could occur due to a lot of other conditions, liver issues, also in children when they have issues with bilirubin at birth, they could also present with jaundice. So that is general examination. We look at those cardinal signs. So after that, based on the symptoms that you explained, each symptoms could represent an ailment in a given system within the body. So based on the symptom that you explain now, we are going to examine the particular system that has been affected. So if you had a stomach issue, we are going to examine the abdomen. If you have a headache or any other issue, we are going to examine the central nervous system. So it is important the doctor gets to examine you. They have to look at you, touch you, feel for the lymph nodes and all those other things. If it is the respiratory system, we also have to look at you, how you are breathing, and also to auscultate or listen to the chest, how you are breathing. So it is absolutely unethical to get into the consultation room, you explain your symptoms, the doctor that does not examine you, they just tries for you the test to go get tested. No, that is not the right thing. So after the examination, at this point, the practitioner should already have about 97% diagnosis of your condition. 97%, so that by the time you're being sent to the lab is just to confirm the remaining 10%, so that we'll be able to know exactly the diagnosis that you have. But even at this point of examination alone, a diagnosis should already have been reached by the practitioner, such that you really don't need to go to the lab for the practitioner to come up with a prompt diagnosis. So lab tests are just to support the diagnosis that has already been made up to this point of examination. So if someone tells you that you have to go to the lab first so that we get now the diagnosis, no, that one should not be the case, because one day you may find yourself in a setup where there is no lab, but you are sick, so you have to be treated. So this, listening to your history and examining you, this one should have given us, if it is a competent practitioner, about 90% of your diagnosis, and each and every competent practitioner should be able to treat you with that. So after that, if it is a well-equipped institution, you'll go to the lab and the results will be brought back to the doctor. So once the results have been brought back, it is only prompt and just fair that your results be explained to you, what has been found and the final verdict and the diagnosis, and after which the correct medication will be prescribed based on the diagnosis. It is also important that you know that you get counseled on some of the side effects of the medications that you are going to be given, and also the practitioner gets to inquire any form of medication that you could be allergic to. So basically, in a nutshell, that is what you are supposed to expect whenever you visit a hospital or you come in for a consultation. So if you get anything short of that, know that you are getting service that is substandard. So ideally, that is what's supposed to be done. But I wonder, is that really how we do it? Especially in our government institution down here in Kenya. That is food for thought. So for any further inquiries or private consultations, kindly contact me on the contact which will be pinned down below, and kindly consider subscribing to this channel, and let us meet on the next episode